acute lymphoblastic leukemia. All can also occur in teenagers and young adults, although it is less common in this age group compared to children. However, when all does occur in adolescents and young adults AYAs, it often presents unique challenges in terms of diagnosis, treatment, and supportive care. Here are some key points about acute lymphoblastic leukemia in teenagers and young adults. Incidence: all is more prevalent in children, but it still represents a significant proportion of leukemia cases in teenagers and young adults. AYAs are typically defined as individuals between the ages of 15 and 39, and all is one of the most common types of cancer in this age group. Symptoms: the symptoms of all in teenagers and young adults are similar to those in children and adults and may include fatigue, weakness, pale skin, fever, easy bruising or bleeding, frequent infections, bone or joint pain, swollen lymph nodes, and abdominal discomfort or swelling. AYAs may also experience symptoms such as loss of appetite, weight loss, irritability, and difficulty concentrating. Diagnosis: diagnosis of all in teenagers and young adults requires a thorough evaluation, including blood tests, bone marrow aspiration and biopsy, imaging studies such as X-rays or CT scans, and other tests to determine the extent of the disease and its specific characteristics. AYAs suspected of having all should be referred to a specialized cancer center with expertise in treating young adults with leukemia. Treatment: treatment for all in teenagers and young adults is typically based on risk stratification, which takes into account factors such as age, subtype of all, genetic abnormalities, and response to initial therapy. Treatment may involve a combination of chemotherapy drugs administered in phases, as well as targeted therapy, radiation therapy, stem cell transplantation, or immunotherapy, depending on individual factors and disease characteristics. Challenges: AYAs with all face unique challenges compared to children and older adults, including issues related to compliance with treatment, fertility preservation, psychosocial support, and transitioning from pediatric to adult oncology care. Comprehensive supportive care is essential to address these challenges and optimize outcomes for AYAs with all. Prognosis: the prognosis for AYAs with all has improved significantly in recent years, particularly with the use of more intensive chemotherapy regimens and targeted therapies. However, outcomes can vary depending on factors such as age, genetic abnormalities, response to treatment, and access to specialized care. Overall, the management of all in teenagers and young adults requires a multidisciplinary approach involving pediatric and adult oncologists, hematologists, nurses, social workers, and other healthcare professionals to address the unique needs of this population and achieve the best possible outcomes.